Good morning, everyone. Thank you for joining our session, Sustainable Future, Fostering Refugees' Self-Reliance Through Water-Saving Solutions. My name is Keith Cole. I am the leader for humanitarian and multilateral business at SATO, part of LIXIL, and glad you could join us today. Before we jump into our program, I want to have a quick quiz. According to UNHCR, what is the average time that refugees are displaced? So everyone's online. Please feel free to put your response in the chat. Yeah, I see we have responses coming in. Maybe just a few seconds more. Okay, can we move to the next slide, please? So for those of you who thought 20 years or more, that is correct. UNHCR estimates the average length of major protracted refugee situations is around 26 years, which is really quite amazing. So a quick overview of today's agenda. I will do a brief introduction. Then I will hand it over to Evelyn Timanina from Peace Winds Japan, who will provide a case study. Peace Winds is one of SATO's valued partners. And then we will have a panel discussion moderated by my colleague, Seti Tamir from SATO. After that, we'll have some questions and answer time, and then I will wrap us up at the end. So growing humanitarian needs are at an all-time high. According to UNHCR, in 2024, more than 123 million people were forcibly displaced. That is a 6% increase over the previous year. Of that total, on the African continent alone, UNHCR reported that a little over 42 million people are residing in camps or requiring assistance. Kakuma and Kalobeyei camps in northwest Kenya exemplify this crisis, which colleagues and I had the chance to visit 2 months ago. We learned that even today, over 200 new people arrive each week just at the Kalobeyei Reception Center, which is shown in this picture here, and which is unfortunately already over capacity. Fortunately, in Kakuma and Kalobeyei refugees had the opportunity to generate incomes. So in partnership with Peace Winds Japan, SATO is implementing market-based sanitation approaches such as these Duka-Safi shops, which are run by trained refugee entrepreneurs, as you can see in this picture. These shops have sold and installed thousands of SATO sanitation products, all to support local entrepreneurs and small businesses in the sanitation sector in order to create jobs, improve health outcomes, and empower social mobility. At SATO, we offer a portfolio of new, durable, easy to transport, and rapid to construct humanitarian sanitation solutions, including the SATO pan, slab, pit liner, and superstructure. These products have been designed to address the sanitation needs of displaced populations at an affordable cost. That said, we constantly seek user input and feedback to better improve our products. SATO products are designed for water-scarce environments, such as northwest Kenya, where Kakuma and Kalobeyei are located. The SATO pan, for example, uses less than 1 liter of water per flush, while the SATO tap requires no more than 100 milliliters of water for a safe hand wash, thus promoting hygiene and mitigating the risk of disease. SATO has a proven track record of supporting humanitarian efforts in conflict zones and informal settlements, partnering with organizations like UNICEF and Doctors Without Borders in Gaza recently. And soon, we will be further testing our new humanitarian products, including our slab, pit liners, and superstructure in the Democratic Republic of the Congo, South Sudan, Sudan, and in Northwest Kenya. Regarding Sudan, it currently is considered by the UN, the International Rescue Committee, and others to be the most dire humanitarian crisis in the world. So we are very keen to support relief efforts there. So having said that, I would now like to turn the conversation over to Evelyn Tumaina, Program Coordinator with Peace Winds Japan, who will present a case study of our collaboration in the Kakuma camp in Kenya. Over to you, Evelyn.
UNHCR and the government.
Yes, Evelyn?
Who are we as Peace Winds? We are an international NGO that supports people affected by natural and human-made disasters. That includes Kakuma refugee camp, Kalobeyei integrated settlement, and the Dadaab refugee complex. We've been in Kenya for since 2012, and we've been operating in Kakuma refugee camp for some time now, and started our WASH implementation in 2018 in Kakuma. And we are currently the IP for WASH, logistics and shelter for UNHCR in Kakuma and also the Dadaab refugee camps. And we partner with several donors and also partners, and also working with the private sector. And this includes SATO, who've been partnering with us since 2018, supporting displaced communities in Kakuma refugee camp and Kalobeyei integrated settlement to access improved sanitation options. And in the recent past, as mentioned by Keith already, we've had an increased number of people fleeing their home countries. And this could be for many other reasons, but this also include climate-induced disasters. And the current population in Kakuma and Kalobeyei integrated settlement is over 300,000. And between 2023 and 2025, we've seen more than 43,000 refugees and asylum seekers arriving in Kakuma refugee camp, being received in Kakuma refugee camp and Kalobeyei integrated settlements. We are looking at an average of over 70 on a weekly basis. And so that has also really increased the population within the camps, and also the needs, and also really, especially the WASH infrastructure is really limited, because we are looking at the WASH, the sanitation and hygiene latrines that we have within the reception centers. We are looking at the community where they're being relocated to, and we are looking at the shared options that we have. And as you will see as we progress, that most of the sanitation options that we have within the camps are pit latrines. And so we are looking at that infrastructure as really something that really needs to be improved, and communities need to look for options that they may be able to also have sanitation options that are really improved and that are good, and are also like climate resilient, that are also like use little water for flushing. And from I think for some time now, and looking at this year as well, we've really seen that it has shifted towards self-reliance. And we are looking at also the government supporting refugees and asylum seekers, and also policies that are also really supporting that. We are looking at the Shirika plan. We are also looking at the Refugee Act of 2021. And so we are looking at options that are really going to support refugees and asylum seekers to really settle within the communities that they are currently, and also just looking at options that are also really affordable, and ones that can be used in that particular context. And now that we are using SATO, we are using pit latrines most of the time. What options do we have to be able to really improve that? And the best we can say for now is the SATO option. The context, as we will see, is we are currently, for the household water use, 95% rely on piped water distributed through communal tap stands. And we are currently looking at an average per capita water consumption of 15.3 liters per person per day. This is way below the recommended standard of 20 liters per person per day. The sanitation coverage is at 76%. And as mentioned earlier, most of these are pit latrines that are in the camps. For sludge management, we currently do not have, we're just starting to operationalize the decentralized treatment facility, and we still have a long way to go. So we are looking at options of dislodging the already existing sanitation options, and we are limited in that. And we have what we've tried to explore is on manual pit emptying currently, but hopefully as we continue with the conversation, we'll be able to really have better options for dislodging these pit latrines to also really help communities be able to use them for a very long time. We've for sanitation options as well, we have the urine diverting toilets, the UDDTs, that have been constructed within the refugee camps because of because of the soil structure. Some places are really very rocky, but then we've really not been able to do the dislodging to be able to have communities continue using those facilities. So with the operationalization of the DTF, we'll be able to support communities to be able to do that. But then conversations are also with the communities to really contribute to this, and also the government supporting as well. We have options for market-based sanitation, and currently we are looking at the SATO products. We also are still working on other technological options to really be able to help communities be able to have improved sanitation options, and currently have what we call Duka-Safi, or sanitation shops that stock sanitation products or hygiene products, which include the SATO products. We also have reusable pads that are being produced also locally. We have soap and other detergents that are also produced locally by communities within Kakuma refugee camp and Kalobeyei integrated settlement. And this is towards fostering self-reliance and also really supporting communities to have access to sanitation options, even with the limited resources that are currently within the context. And we are looking at communities also creating employment for fellow communities, having access to those products at an affordable price and without really having to look far for those particular products. For solid waste management, we also are looking at options within the camp, and one, building infrastructure to really support solid waste management. And we are really working with the local community. We are looking at the refugee-led organizations. We are looking at the community-based organizations within the host community as well. And so agencies are coming together to really help communities build infrastructure. And this also includes capacity development for them to be able to take up the initiative once the agencies have left. And so we've also
So, Evelyn, we can't hear you. Maybe
Am I the only one not hearing Evelyn?
no. Also, we can't hear her.
of communities that are paying for some of these services, with having conversations with them about just supporting communities, especially the conversation of sorry. And so most of those facilities were not in use. But then later, when they came and looked at it, did an analysis as a community, as a household, the resources they were using at the facilities because of diarrheal diseases, and the emotional turmoil that comes with that, because you have to move from one point of the camp to the facility. You have to use resources for the transportation. And so after the analysis, communities decided that they're going to work together to just ensure that they have sanitation facilities, that everyone is able to use those facilities. They have hand washing facilities that they are also using, encouraging school-going children to also use those facilities. And so over time, we were able to eradicate open defecation within the camps, and were able to declare the settlement ODF, though we still have a lot to do because of the people or the individuals that are still coming within the camp. So as they come in, we also ensure that they are also oriented on what's happening and how they're able to use those facilities that are available, especially the shared family shared sanitation facilities. And so the operationalization of the Duka-Safi came after the open defecation-free communities were declared. And now with also the support from UNHCR on the cash-based intervention for the construction of houses and sanitation facilities, most communities were able to acquire some of these products, and they were able to improve their sanitation facilities. And we've also seen the elderly getting the SATO tools, and this helps them to really access those facilities, because initially it was a challenge for people living with disability. Communities that were old were not able to access those facilities, but now with the SATO options of the SATO tools, we are able to have communities use those facilities. We've also seen that adapted by some institutions like schools, to have them as also an inclusive facility within the institutions. And also the SATO tap has really come in handy to support communities. And we've also really seen that support recently with the cholera outbreak in Kakuma. We're able to support communities with the SATO taps. And as we looked earlier, the water situation within the camps is also really limited. And so with a SATO tap, we are able to use limited water or little water, and communities are able to wash their hands after toilet use. And that has been done for some time now, and so many people have been able to be reached with that. And so with also the refugee-led organization, the community-based organizations within the host communities, as they take up initiatives to support communities with solid waste management, with sludge management, there's also an option of improved sanitation options. And so they're taking up that initiative, and you will see that we have so many CBOs and RLOs currently within the camps that are supporting WASH. And we are looking forward, even as we look at Shirika plan, at the integration, at having communities self-reliant. We are also looking at building that capacity and supporting them to be able to continue supporting communities to have access to sanitation options. We've also seen as the technology by SATO on the SATO UDT that we are piloting within the camps as well, to see that that also really supports communities to be able to have improved sanitation options. And so as I wrap up, what we are looking at currently is to operationalize a centralized Duka-Safi, one that we can use to capacity build communities to be able to continue with the production, local production of reusable pads, local production of the slabs that are used for latrine construction, soap making, and general community engagement, and SBCC, the social behavior change communication as well, so that we can continue having communities that are healthy, and also just reduce the diarrheal trends, and also eliminate cholera completely from the camps. We are also looking at linking the RLOs, the CBOs, the hygiene promoters to local markets, so that they can be able to actually source raw products and also sell out their products, and also linking them to financial institutions. We've already seen that has happened. We've received some grants and some support in form of loans from some of our partners like in Komoko to support the operationalization of other SATO shops, and also grants to some of those RLOs to be able to expand their businesses. And then we are also looking at inclusion of forcibly displaced and stateless persons to national systems. And this includes the Kenya Revenue Authority to be able to have access to those documentations. And also looking at, recently, we are also looking at registering them, registering the communities their SIM cards for them to be able to really have access to SIM cards, the Safaricom SIM card. They can transact receive money as they sell out. And also we are also advocating for ease of movement, especially for business people who are supporting this Duka-Safi within the region. And that is looking at the northern region as well as even the city itself. Thank you. Thank you so much. Over to you, Keith.
Okay, thank you, Evelyn. Very, very helpful overview for everybody. Now I would like to turn it over to my colleague, Seti Tamir from our partnerships team, who will lead a panel discussion. Over to you, Seti.
Okay. Hi, everyone. My name is Seti Tamir, and I'm a project specialist with SATO, working for the Global Partnerships team. So thank you for joining us. And we've set up a panel discussion with 5 speakers who will be sharing their lived experiences and reflections on some of the things that Evelyn has set in the scene for us. So reflecting on the considerations that we should bring to designing solutions anchored in entrepreneurship and livelihoods for refugee communities, some of the governmental mechanisms to support climate resilience sanitation in Kenya, and looking ahead at the opportunities for linkages between sanitation and other WASH subsectors. So without further ado, let me introduce to you our panelists. And if I could ask maybe someone to pin them as I'm doing the introductions. So David, so we have Akiko Shiba, who is the country representative for Peace Winds Japan in Kenya. She leads programs in WASH, infrastructure development, and food security for refugee and host communities in Kenya. We have Alex Njagi, who is a business leader for Kenya at SATO LIXIL, playing a leading role in SATO's business development in Kenya and several other African countries. We have David Orach, who's a hygiene promoter, supervisor, and entrepreneur in Kalobeyei integrated settlement. He settled in Kenya in 2018, and he's long been active in the WASH space, playing an active role in his community with regards to CLTS, supporting communities towards ODF and post-ODF, and now market-based sanitation. We have Lucas Sedete, who is the Director for Preventive and Promotive Health at Turkana County Government. And last but not least, we have Dr. John Wagacha Burton, who is a Senior Public Health Officer at UNHCR Kenya, leading the health and WASH sector. He brings 26 years of experience in refugee health and has been recognized by the CDC for his work on respiratory disease surveillance in Kenyan refugee camps. So thank you all for joining us. And to the audience, please feel free to put your questions in the chat as the panelists speak. There will also be time reserved for questions after the panelist intervention. So I'd like to first invite David Orach for the first question. So David, as an entrepreneur, what has been the effect of sanitation initiatives such as Duka-Safi for your business, and what changes have you observed in your wider community? Over to you.
Yeah, good morning, everybody. David, you pronounced my name correctly. The better sense that I have seen from Duka-Safi, the changes that I've seen is, first, Duka-Safi has helped me as individuals for income generations, because by the sales of the SATO, I may be able to get some small cash that will help my family, and also in Duka-Safi, we also have a series of things that we do sell, and also the same times in the community, it has really helped eradicate the issues of cholera, because by the times we came here, I came here, I found a lot of issues of cholera around that I am really facing my neighbors and also the neighboring villages. But by the times we have started working together to see that we really do all our best to kick off the cholera, and we have started the installations of the SATO pans and the SATO stools in quite good numbers of the households, and we are able to eradicate cholera in the past 4 years. And some few challenges that we also do face in this in the Duka-Safi shop is that we have challenges of water in the camp sometimes. We also have the challenges of the product. Sometimes people may need it, but it is not available. More especially the SATO, the SATO pans and the SATO stools. Over to you.
Thank you. And it's heartening to hear of the eradication of cholera in the community. And building off of your response about the challenges you faced and product availability, I'd like to invite Alex Njagi to share with us how basically what are the key barriers to ensuring the availability of sanitation products in remote refugee settings, and what innovative partnerships or market-based approaches could overcome these challenges. Alex, over to you.
Thank you for the question. And I just want to say, from our experience in Kakuma, there are a few key barriers that limit the access of sanitation products in such remote refugee settings. First, I would want to say that it's the remoteness itself. Kakuma is about 750 kilometers from Nairobi. That's over 15 hours by road, and is actually one of our farthest markets. As a result, we experience some of the longest lead times in delivering SATO products, possibly longer than any other of our markets that we serve. This remoteness eventually raises costs of the product significantly, and many traders are actually almost double the prices of different commodities to cover their logistics cost, which directly impacts on affordability and also on supply. Secondly, I'd want to point out on low purchasing power and unpredictable demand, which reduces the incentive for distributors to invest in sanitation businesses. or even stock sanitation products, because these traders are mainly profit driven, and no one wants to carry stock that doesn't move. So case in point, for nearly 4 years since Evelyn said that we started working together, other than Duka-Safi, there were no organic outlets in Kakuma selling SATO products until recently, in the last year or so. So this significantly limited the availability, and especially for the host communities. And thirdly, willingness to buy does not always translate into the ability to make the purchase. Many refugees are not self-reliant and mostly depend heavily on agencies for their daily needs. So with competing priorities, sanitation often are the challenges that we've encountered, and I know there are so many more. But to address these challenges, we've seen a lot of progress through innovative partnerships and market-based approaches. For example, working with local entrepreneurs. These are the CBOs, community-based organizations in both the refugee and the host communities that act as artisans. Some are retailers, others are promoters, and are able to earn a living through their own sanitation enterprises. That's creating both livelihoods while we are building last mile access to the different sanitation solutions. Another example is our partnership with NGOs like Winds Japan, where we are able to consolidate orders from refugee businesses like what David runs. He is one of the people that run at Duka-Safi outlet. All their orders together to increase the stock on track, that's maybe shortening significantly, reducing the costs. So additionally, we have
Alex,
developed shorter and more flexible.
Sorry to interrupt. We've lost you for maybe 20 minutes or 20 seconds. So if you could just
where
go
was
back
I?
a little. You were talking about some of the solutions to these barriers.
Okay, can you hear me now?
Yes, can hear you clearly now.
So I'll just go to the solution that I mentioned, and this comes through our innovative partnerships and market-based approaches. And this include working with the community-based organizations in both the refugee setups and the host communities. And we are able to bring these guys on board as artisans, or capacity build them to be artisans, retailers, sometimes promoters. And this way they are able to earn a living through their own sanitation enterprises. And this creating livelihoods while also creating the last mile approach. And I wanted to say about another example through partnership with Peace Japan, where we are able to consolidate orders from the different Duka-Safi outlets and any other CBOs to increase their order stock. So instead of them ordering individually, we're able to consolidate their orders, and this way we can pack them in a truckload and shorten the delivery lead times, and also significantly reduce the logistics costs. So I wanted to mention that we have also developed tailor-made route to market models these markets, these specific outlets to make the orders now this directly from the manufacturer. And gives them better, this makes the products finally affordable to the households. We are also intentionally bringing on board many partners as possible, even beyond the sanitation space, with the objective of driving demand and capacity building. For example, what we did the last time we were in Kakuma working with a TVET, that's a Don Bosco Technical College in Kakuma, to train or capacitation of our products and also to expose them to opportunities in the sanitation business. So exploring sanitation financing solutions, targeting both the end users, that is the refugee communities, and also the businesses that are investing in sanitation. So finally, I would want to say that from the Kakuma experience, market systems can still work if they are anchored in strong partnerships by enabling the efficiency of private sector with reach of the humanitarian actors, sanitation products with empowering local communities. So did you lose me again?
No, I mean, it was in and out, but I think we caught the most of it. So thank you. And so just bouncing off of that idea of partnerships and the enabling environment to set up such initiatives, I wanted to invite Duka-Safi, who's the Director of Preventive and Promotive Health at Turkana County Government, to speak on what are some of the key policy and financing mechanisms that are available at county level that can and have been leveraged to support climate resilient sanitation. Kenya, over to you, Mr. Adete.
Thank you, Sedi. My name is Lucas Sedete, Director Preventive and Promotive with the Turkana County Government. Thank you for having me here. My network, I am in the border of Kenya and South Sudan, Lokichogi or somewhere in Lokichogi there, so my network is not good. So my apologies ahead of time in case there is some breakdowns on the way. Yes. As the Director Preventive and Promotive, I lead a team that is in charge of sanitation and hygiene in the county. And this is the team that do awareness. This is the team that create awareness in the communities to ensure that issues climate change, to ensure issues sanitation and hygiene has been attended to in the community. Now, before I come to the question, is Turkana County is 77,000 square kilometers, and it's a third of the whole country, and it is one of the arid and semi-arid area, and it sits at northwestern Kenya. And for so many years, we have been in what we call marginalization. And so, but 2013, when there was change in the government policy, devolution came in, is when now we received attention from the national government and from partners. Yeah, so coming back to your question on financing mechanisms, our financing mechanisms are leveraged on the national mechanisms because we have one exchequer from the national government. Is the one that provide funds to all county governments, and so we have this public finance act, which ensures that all counties access funds for development and also for attending to the climate change and resilient activities. And so as a county government, we have We have developed policies like the county integrated development plans, which help us to, map out and to zero in on the areas that require attention that has been necessitated by climate change in the county. And these are the from that plan we are able to do budgeting that is targeted to climate change projects, because in the recent past we have seen floods washing away sanitation facilities like toilets. We have seen floods sinking our boreholes that had already been sunk. We have seen floods erasing the gains that we had made in the sanitation sector, and so these funds help us to rebuild the same infrastructure which we had built up. Thank you, Sedi.
Great. Thank you, Mr. Adete. So it's great to learn about the sort of the policy environment of devolution that allowed I think the government to refocus on vulnerable communities, as well as the Public Finance Act that then came in as a mechanisms to help respond to sort of maintaining, sustaining, and building on the sanitation gains that were made. And with that, I would like to invite Dr. Burton to kind of bring it all together and speak about the sort of specific climate-related vulnerabilities that should be considered when designing entrepreneurship and livelihood programs that are focused on sanitation and refugee communities. Over to you, Dr.
Thank you very much and for giving me this opportunity to contribute to this discussion. To contextualize further, the Kakuma is located in a semi-arid part of the country, which is prone to drought alternating with floods, and that brings specific vulnerabilities, which are environmental and climate related, resulting to damaged sanitation infrastructure, the contamination of water, or even disruptions of livelihoods and income generating projects or activities. And therefore, while designing sanitation related enterprise, it's good to look at the design to make sure that it is flood proof, e.g. elevated latrines. Drought tolerant technologies are also important, but also having a flexible business model that can adapt to seasonal variability. The other vulnerability is looking at the infrastructure, specifically how fragile it is, and also aging systems, considering that the many camps have stayed for decades without adequate infrastructure upgrading, and therefore the sanitation system is aging and they are vulnerable to breakdowns during the climate shocks. As a result, it is good to have an enterprise that focuses on training in maintenance and repair, upgrading of the sanitation systems, but also promotions of innovations. And this is a good example of what SATO is bringing into this space. The third one is the limited adaptive capacity, lack of early warnings, lack of education, climate education, and also financial resources that can continue supporting their livelihood. But also refugees don't own land. And quite often they are just stuck there, they don't move freely or access to markets. And therefore, in the building up the solution, it's good to have an education and skills training, but also capacity in climate adaptation planning, but also financial literacy and microfinance. The fourth one is the health risks from climate impacted sanitations. As David mentioned earlier, the hazard, this climate hazard exacerbates public health risks, resulting to outbreak of either sanitation-related diseases like whether cholera or polio, or even other environmental-related diseases like malaria. And therefore, it is good in the enterprise to also focus on public health awareness, promote safe sanitation policies or practices like what PWJ has done on community-led total sanitation, but also support the businesses that provide sanitation and hygiene products across a home. And what David is doing in Duka-Safi is with the support from SATO is a good example of bringing the products close to people, considering the remoteness and also what Alex is looking at, making it more efficient. And lastly, is looking at the gender and social vulnerabilities, where women and girls are disproportionately affected by climate-related sanitations, failures. For example, if they are to do not have latrines, or they don't have even water and other hygiene products close at home, the girls even end up dropping schools or not even engaging into reasonable livelihood. And therefore, the sanitation enterprise should also be gender sensitive, looking at the issue of safe and accessible sanitation solutions, and also empowering women through targeted enterprise support. Thank you very much.
Thank you, Dr. Burton, for drawing such a holistic picture of considerations we need to account for as we look ahead. And with that, I'd like to invite the last panelist, Akiko, to also reflect on sort of looking ahead. What are some of the promising opportunities for creating stronger linkages between sanitation and other WASH sectors to strengthen the resilience of refugee communities in the face of climate change, which brings about so many intersecting challenges? Over to you, Akiko.
Yeah, thanks a lot, Teddy, for that question. So in my perspective, one of the biggest opportunities to strengthen the link between sanitation and other WASH services is to bring together the strengths of the different the actors, now communities, governments, markets, and the civil society, yes, to build strong and more resilient systems. In Kakuma and Kalobeyei, as Evelyn and David highlighted, that we have seen real progress in sanitation. The refugee communities have actually really changed the sanitation landscape from the time when the open defecation was a norm. Yes, the people building the latrines, they really maintaining it, and then adopted something like a SATO products. Actually, the adopting products like SATO means that they actually invest their money into the products for improving their sanitation and hygiene in their communities. Actually, but this change that didn't happen by communities alone. Actually, it happened because communities, governments, the private sector actors like the SATO LIXIL, and then the civil society like us with the support from the UN agencies or other donors, actually they work together to turn the shared vision into the action. So this shows us what's possible when the community ownership, actually take ownerships, and then when the other actors create the right environment for the community to succeed. And then this creates an opportunity to link this success in sanitation with other WASH services, especially where the resources are under the pressure. So let's take water supply as an example. In recent years, per capita, the water availability in Kakuma and Kalobeyei has declined because of population growth and then also shrinking resources. The communities have actually shown the different the responses. In some communities, the residents are organizing themselves, the fencing of the public taps, and then making sure that everyone gets fair access to the water. But in other areas, actually that frustration has led some people to damage pipes to get water. So these contrasting responses actually show the why collaboration really matters. That we need to help communities learn from each other, to introduce affordable and appropriate technologies, and then that connects them with market actors who can offer solutions, while governments ensure these solutions fit into the formal service delivery systems. This kind of multi-actor collaboration is becoming even more important as the Kenyan government moves toward integrating refugee, the services for the refugees and the host communities under the government-led service provision systems. To make this system sustainable, everyone has a role. Communities that lead the actions locally. And then the governments provide frameworks and then policies, and then the markets that bring the innovation. And the agencies like ours support connections and then build the capacities. Climate change makes this challenge even more urgent. In Turkana, where Kakuma is located, the groundwater resources are quite significant but not unlimited. The unpredictable rainfall and then recurrent droughts are already affecting both refugees and then host communities. And with limited funding and then scarce the natural resources, resilient systems will only be possible when we combine community actions, appropriate technologies, and then the market linkages and solutions, and then the government support. So we already actually seen what this looks like in a solid waste management, as Evelyn also explained a bit. The Peace Winds is working with the Kakuma municipality to create recycling-based solid waste management system. The community-based organizations and the refugee-led organizations, especially with youth who wants to keep their communities clean and then create the business, the work alongside with municipality, the municipal authorities, and then the recycling companies who actually want to take those the waste for their the recycling business. So when all of them come together, they are actually turning waste from the health risk into the resources of opportunity and then wealth. So looking ahead, the opportunity is not only about community ownership. Yes, it's about stronger collaboration, as actually all the presenters mentioned, across the all actors. The building on the energy and the success that we've seen in sanitation. Apply those lessons to the water and then solid, the waste, the sludge management, and then all aspects in the wash. They use technologies, markets, and the government frameworks to enable and then empower communities as to act and then sustain the progress. So in a nutshell, by working together in this way, we can build resilient and sustainable wash services that helps the refugees and the host communities adapt and then thrive. Even in actually the current situation is quite difficult in the camp. Since we are really facing the shrinking the resources for the humanitarian the assistance and then also the climate change. Yeah, so that is my remarks. Yeah, thanks a lot, Teddy. Over to you.
Right. Thank you, Akiko, for ending on that hopeful note. And we have 4 minutes remaining. I think there's a question and answer session, but I see that the questions are also being answered in the chat. But maybe we can take a minute. If there are burning question that someone wants to ask, please just open your mic and address it. So I'll just, yeah. If not, I'll hand over to Keith. I'm just going through the chat. So there's a question for Mr. Arach. Okay. There's a question from Rana. Although Kakuma camp reached ODF, cholera outbreaks seem to continue. Dr. Burton and Kiko, you seem to have linked climate change, such as droughts and floods, to cholera outbreak. Is there a specific example for the cause of the most recent cholera outbreaks? I think that would be a question for Dr. Burton.
Yeah, the cholera that happened recently in Kakuma happened at a time when there was water shortage. As you know, the boreholes in that area are low yielding and continue to so because of the climate impact of climate change. And then there are water collection, water pods all over the different parts of the camps because of some floodings. And therefore, even if the index case is linked to the outbreak in South Sudan, the propagation took place locally, and it was related to sanitation-related factors on the ground. Over to you.
Sedi, can I say something there?
Yes, sure. We have about a minute before we conclude. Go ahead.
Yeah. As I said, I lead a team of public health officers who do not only sanitation and hygiene, but surveillance. From our surveillance point of view, the cholera outbreak in Kakuma did not originate with us. There is an active cholera outbreak in South Sudan with over 2,000 cases. So that was an imported case for us, but as a county, we were vigilant and we were able to contain the same. Thank you.
Thank you. So Keith, over to you.
Sure. Well, I want to thank everybody for joining. Thank you to all of our panelists. I think it was a very robust conversation. Certainly drove home the importance and the impact of climate change, particularly in a semi-arid environment like Northwest Kenya and other parts neighboring there in Africa. And so very informative information for us to consider. Thank you again to the panelists, and thank you especially to everyone who joined in, and I hope you enjoy the rest of World Water Week. Thank you again.
Thank you.